Hello viewers, I'm Dr. Tolulope from Vijolaya, a med scientist by profession, and I'm going to be speaking on the importance of food blood count in the management of patients. The importance of food blood count in the management of patients. So what is food blood count? Food blood count is a set of medical tests that is used or requested to investigate the type of cell in the patient's blood. And the blood contains the fluid portion known as plasma, or the cellular portion that contains the red blood cell, the white blood cell, and the platelets. The food blood count provides wide range of information about the cellular components of the blood, and sometimes it's requested for medical assessment to monitor health and then to diagnose diseases. The result of food blood count is usually interpreted by comparing with reference range, which varies with age and sex. Please note that it's not all food blood count results outside reference range that required medical intervention. So the food blood counts can give information about anemia, bleeding disorder, cancer. The red cell indices provides information about the size of the red cell and the hemoglobin content of the red cell. The red cell indices, one of the parameters is the mean cell volume, which is abbreviated as MCV. The mean cell volume provides information about the size of the red cell. In anemic cases, when the mean cell volume is below the reference range, it is called microcytic anemia. In anemic cases, when the mean cell volume is normal, it is called normocytic anemia. When the mean cell volume is above the reference range, in anemic condition, it is called macrocytic anemia. Also, we have the mean cell hemoglobin. The mean cell hemoglobin provides information about the hemoglobin capacity of the red cell. It is usually abbreviated as a MCH. When the MCH is below the reference range in anemic condition, it is called hypochromic anemia. When it is normal in an anemic condition, it is called normochromic anemia. And when it is higher than the reference range, it is called hyperchromic anemia. The last red cell indices is the mean cell hemoglobin concentration. The mean cell hemoglobin concentration also provides information about the hemoglobin content of the red cell relative to the size of the red cell. And when it is also low, below the reference range, is also called hypochromic anemia. When it is normal in an anemic condition, it is called normochromic anemia. And when it is higher than the reference range, it is called hyperchromic anemia. So the red cell indices alone provides information about the cause of anemia. In the condition of microcytic hypochromic anemia, the possible cause is deficiency in iron, thalassemia, and thalassemia is an abnormal hereditary condition in which the hemoglobin has low oxygen carrying capacity. So when there is microcytic hypochromic anemia, the likely cause of it is iron deficiency, lead poisoning, and thalassemia. When we have an anemia condition that is nomocytic nomochromic anemia, the possible cause of this will be sudden blood loss, aplastic anemia, the use of artificial heart valve, and then sudden blood loss, use of artificial heart valve, kidney failure, aplastic anemia, and let me move on. Now, the last part is macrocytic hyperchromic anemia. In this case, when we have this condition, the possible cause of this condition is deficiency in folate, deficiency in vitamin B12, and exposure to chemotherapy during the treatment of cancer. So these are the likely cause of abnormalities in anemia cases. Now, going to the volume of blood. The volume of blood, which is always called PCV, packed cell volume, gives information about the level of blood in the body, and it can help to detect whether the patient is having anemia or polycythemia. Now, that's talking about evaluation of the red cell. Evaluating the white blood cell. There is white blood cell total and white blood cell differential. White blood cell total will provide information on whether a patient is having viral infection or bacterial infection or leukemia and other information. Now, analyzing the differential cells. The differential cells result can give a clue on whether a patient is having bacterial infection, viral infection, parasitic infection, allergic reaction, or malignancies or cancer. Then platelets count. The analyzing platelets will help give information on whether a patient is having abnormality in the level of platelet. And platelet is one of the cells that help in clotting of blood. So deficiency in this can also result into different complications. So a full blood count, because of the wide range of information it provides, is one of the most requested medical laboratory tests, which is used to assess patient medically, monitor their health, and carry out diagnosis. There are different relevance or importance of full blood counts in patient management. In medical emergencies, a full blood count can be used to investigate fever, abdominal discomfort, trauma or bleeding disorder, and infection. In surgery cases, a full blood count can be used to investigate anemia, infection, and platelet level, and after surgery, bleeding, loss of blood. Now, a full blood count is also relevant in prenatal care, because when a pregnant woman has an anemia, it can lead to poor outcome in both the mother and the baby. Cases of jaundice, and when WBC is observed to be small, can be an indication for sepsis. Full blood counts can be used to monitor psychiatric patients who are on drugs, because some of the drugs can impair the production of cells, of the blood cells. Also, in the treatment of cancer, the administration of chemotherapy or radiation therapy can also impair the bone marrow, which can lead to impairment of the production of all these blood cells. So a patient that is already diagnosed for bleeding disorder or any blood abnormality is expected to monitor his or her full blood count regularly. So it is expected that when patient comes into the health facility, whether primary, whether secondary, whether tertiary or a private facility, one of the tests that should be used to investigate the condition of the patient should be a full blood count, because it provides a wide range of information. It gives information about the possible cause of the patient's complaint. So this is expected that full blood count should be done, because it will give a wide range of information before other tests or other investigations are done based on patient's complaint. So I conclude by saying full blood count is very vital in the management of patients, monitoring of patients' health, treatment of patients, and medical diagnosis, because it will help the clinician or caregiver to provide a wide range of information that will help the caregiver to take an informed decision in the treatment and management of the patient. This full blood count, we only required a venous blood to be taken from the patient, and it can be done manually or using of an automated analyzer, hematology analyzer, and the turnaround time is approximately 1.5 hours. So I hope I've been able to emphasize or enlighten on the importance of a full blood count in the management of patients. Once again, I'm Dr. Tolulope Funbijolaya, a medlab scientist by profession. Thank you, thank you, thank you.